Thanks for tuning in to the Zelos podcast. I'm Rocky Snyder. This week, I've got Danny DiGregorio with me. He is a physical therapist for the Minnesota Twins organization. However, before we get underway with our conversation, if you're looking for continuing education, consider the workshops, either online or in person, that I offer. You can go to my website, rockysnyder.com. We've got CEUs available for physical therapists, athletic trainers, strength coaches, personal trainers, and even chiropractors. So rockysnyder.com is where to go. But if you want a master's degree of science, consider Satanta College. They've got it in applied sports biomechanics and movement science. They've got a program for applied sport and exercise psychology, as well as sports injuries and return to performance management. And finally, a Master's of Science in Performance Coaching. Just go to satantacollege.com, enter in RS10 for 10% off your tuition. Follow us on Instagram at Rocky_Snyder. Click the subscribe button. Here we go. Well, Danny, I can't thank you enough for coming on to Zealous. I think we just jump right into this. How did you get to be with the Minnesota Twins? I look at your resume, and it's like my major reel when I was in college. Like every semester you spin, and whatever it lands on, there you are. It's like you have 8 different positions with 8 different teams, and now you're with the Twins. So first, welcome, and how the hell did you get where you are?
Yeah, thanks for having me, Rocky. I guess, how far back do you want me to go? I guess that's the question, but
How about to that high school injury, whatever it was, that enticed you to follow this pathway? Because I know that's the case. What happened?
yeah, the typical become a PT after going to PT story is kind of what happened with me. But my mother is actually also a PT, so I was kind of familiar with that route. I knew I wanted to do that early on. I had some different injuries in high school. I had like a hip labral repair, both hips done, and then some other things along the way. So I think that was kind of like a big injury for me, and something that kind of steered me a little bit more towards a PT path, like a little bit quicker than I would have guessed.
But you had bilateral labral tears?
Yes, I did.
Were they concurrent, or they one then the other?
So I had the left hip done like junior year of high school, and then I had a revision done like end of high school on the left, and then the right again like 3 months after. So I actually had 3 hip surgeries.
Motocross? Were you a catcher in baseball? What was it?
I was a football player and baseball player. I think just mostly from football, taking a beating. I was
Dude.
like 150 pounds soaking wet. So
All right. So then you got repaired, you got on the road, and you decided to head to Sacred Heart and go to school there. And so what did you go to school for?
yeah, so I studied in undergrad. I did exercise science for 4 years, and then stayed in Connecticut for another 3 to do my DPT in physical therapy. Had a great time in Connecticut. We joked earlier, I think that's where I lost my New York accent, but it's still underneath there at some points. So,
Dude, I left my Boston accent back in Massachusetts like 30 something years ago. No one knows where I'm from.
that's funny.
So, okay, was it sports PT, or was it a certain line of physical therapy? Were you going clinical?
Yeah, I guess Sacred Heart has a really good ortho program. So that was kind of the track that I was on. We didn't really have too many like specialty areas at the time. But during PT school at Sacred Heart, I had some great clinical opportunities. Spent some time at a place Resilient in New York City, and they have a hybrid office in New Jersey. And that was like my first like real exposure to like working with athletes in the PT setting. So that kind of like made me a little more interested. Then I finished PT school, worked in Manhattan for about a year and a half or so in the outpatient orthopedic realm, just getting some reps and some experience with like more general population, some athletes here or there. And then I guess that summer, after my first year or so, was kind of getting a little bit bored of just the routine of, treating like a high caseload. So a job opportunity came up, just found it online to work in an indie ball team, the Empire State Grays. So I traveled with them for a summer. It was one of the best summers of my life.
Why? What made it one of the best summers? Just because the chicks were everywhere and you were drinking up a storm with the team, or
I think it was the travel was the cool part. So I got to work in the dugout. That's a little bit less of what I do right now. But we would travel. We went up to Canada, different parts in the Northeast, all the way out to like St. Louis. So I got a good amount of like experience understanding, like from a baseball perspective, the travel and what goes into that type of stuff for those guys. And that kind of led to the opportunity I had with the Mets and then eventually the Twins a year later. So
Right on. And baseball is where you want to be?
yeah, for sure. I really enjoy the sport.
Why is that? What aspect of it that you really enjoy?
I think growing up, it was probably just my favorite sport to play. But as I've gotten older and I like to go into the biomechanics of things, some of the complexities. I think baseball is, with all the data that they have now, it's like truly a unique sport, and there's so much you can dive into. So I'm just kind of touching the surface with some of that stuff, whether it's the pitching or hitting side of things. But I'm like an endless learner, so I think it kind of gives me like a good challenge of like trying to learn different things.
Right
So
on.
that's kind of why I've stuck it out here.
Wait, do you grow up in Brooklyn? Is that right?
Limbrook, so it's kind of an
Uh,
offset outside of Long Island, but
oh, Long Island. So you're a Mets fan? Yeah.
uh, I'm a Twins fan, so
Well, yeah, I know. Obviously, you can't upset the bosses there. But when you were younger, what team were you rooting for? It wasn't the
I
Twins.
sure I actually grew up. I was pretty close to City Field, but I actually grew up a Yankees fan.
Oh, that's almost worse. Okay, that's all right. Being a born and bred Red Sox fan, I think we can continue this podcast without any real problems. But and were you? Let me ask you this then: were you born after the 1986 World Series when the Red Sox and Mets faced off against each other?
I was, yes, I was born in.
Perfect. So we don't even have to talk about that. You have no memory of it whatsoever. Excellent.
Yes.
Okay. So you're down in Fort Myers, Florida. You're at the complex, and what's going on? You're at least halfway. You're actually past the halfway mark of the season, right?
Yeah, for sure. So just over the halfway mark. They kind of go in waves here. So right now there was a little bit of like a lull, and now things are kind of popping off again in terms of just staying on top of guys that are getting hurt. We have the FCL season kind of coming to an end. So
Mm-hmm.
guys, a bit of like maybe a week or so off, and then they'll kind of go into some instructs. So they'll have that going on, and then we have the new draft guys coming down. So they'll kind of get oriented with the team, and so there's different things in and out, but for the most part, still pretty busy down here. So
Yeah. Okay. And your caseload, how many athletes are you working with each week on average?
for sure, it kind of varies. It could be anywhere from, the lower like 6 to 7, anywhere up to like 12 to 15. We have other PTs on staff as well. So, depending on the time of year, we might have a little bit more, we might have a little bit less. But that's kind of where we're at right now.
Oh, that's manageable. Okay. So, and then some of the caseloads that you have, without naming names, obviously, are we looking at mainly shoulders and elbows, or
Yeah, it's a
what's,
good mix. So,
yeah.
I mean, you're always going to have your elbows in baseball and shoulders. Definitely seeing a lot of shoulders this year. And then I have a few lower body injuries. So I've kind of been diving into some different stuff, learning perspective on some lower body stuff. I have a few ankles and those other type of things.
Right on. And in your toolbox, what do you have in your toolbox outside of the typical PT stuff?
For sure. I think a little bit of everything. I think I have a little bit of an S&C background, so I try to take things from that. Whether that's, working with the strength coach and trying to find, where can an exercise or something be introduced with me, and then kind of pass the baton per se for some of the more S&C principles. Um, in terms of like my toolbox itself, I think I kind of utilize a bunch of different methodologies. Like I've tried to take what I can from everything, and whether that's using like my hands, using different modalities that players prefer. Pretty open to doing pretty much anything with a guy, as long as, if it's an older guy, I might take what they like a little bit more into account. If it's a younger guy, I might steer them in a direction that I think might be best for them.
And your hours for you, your work hours, 7 a.m. to 5 p.m., or what are we talking?
It kind of depends. I think, generally speaking, we get in pretty early, usually before 7, and then a good day you might get out at 5. Other days you might get out a lot later. So it's kind of ebbs and flows with as things come up during the year.
You get in before 7 to get your lift on, or you just go
Uh,
right to work?
Usually I'll get in. I'll usually lift a few days a week, and I'll get in like at like 5:30. But there's usually stuff to do in the mornings, so usually a little bit before 7 we'll get in.
Okay, I don't think I've ever asked this question, but how does your weight training program differ from the athletes' programs in terms of
So,
design?
uh, I would say not too much. I think I actually follow a similar model, and I kind of do that on purpose because I'd like to kind of see where guys are and understand what they're going through a little bit. So when we're in rehab and you have a guy that's like a long-term rehab, they might lift, 3 days a week. So I try to stick to a pretty rigid 3 day a week schedule of like a true lift, and it'll be like a total body lift with different components based on the programming the cycle I'm in. And then I'll do kind of like aerobic days in between on like a Tuesday or a Thursday or Saturday. So I'll go for a walk, or I just recently got into pickleball, so I'll use that as some of my
Freaking pickleball. Everyone's getting into pickleball. What, you just don't
yeah.
like your body? You want to get injured more often?
That's
Oh my
it.
God.
It's honestly it's a great workout, and it's a lot
Yeah.
of fun than you'd expect. So it's big down in Florida.
You don't say. That's where, yeah. Yeah. But your hair color is so much darker than the average pickleballer. That must be amazing. You go with the grandpa and grandma and you go down there just to hang out with them. Is that what you do? Damn, man.
Yeah.
Okay, so well, that's cool because I could think of it, you've got if this doesn't work out with the Twins, you could open up your own pickleball rehab facility because I think it has overtaken softball as one of the most injurious kind of leisure sports there is. It's crazy.
Sure. Yeah, it definitely has. That's funny.
Okay, so all joking aside, you're a CSCS. When did you get certified with the NSCA?
Sure. So I studied for that. We had a good course in undergrad where we kind of covered the textbook for the CSCS,
Beautiful.
and got to practice some of the stuff in the gym and like work hands-on with one of our professors. So the summer going into PT school was when I studied for it. I felt like it was a good bridge to kind of, this information was fresh in my mind, and I wanted to get that out of the way, and I knew it'd be a valuable tool. So right before PT school, and then I kind of went into PT school, is like able to kind of focus on what I'm doing. So
Right on. And not to put you on the hot spot, but have you ever been to a national conference? Of course, it always occurs in the middle of the summer when you're working, but it's worth a shot.
no, I never have. I know you just were nominated for an award. I think that's pretty awesome, but I've never been to a conference or anything like that.
Oh, all right. Well, if ever it comes out, the coaches conference actually in January might be something to consider too. But
Yeah, off season.
all right, physical therapy. You've got the Graston technique. You've got taping. You've got your goniometer. You've got your force plates. What else are your go-tos that you're looking at?
Yeah, I think honestly, all the above. It's just taking the information that's valuable in the moment. So depending on the injury, I might utilize something a little bit more than the other. But you kind of mentioned like your goni, some of the force plates, like we use that stuff like almost daily. But for the most part, like anything we can get our hands on tech wise, we're definitely open to either trying or utilizing for our guys to get them out of rehab.
All right. Do you have a mentor, and are there people that you're mentoring?
For sure. Yeah, so you had Danielle Onette on the podcast in the past. So she's one of my
Yeah.
coworkers. So I learn a ton from her right now. It's been a great experience working with her. And we kind of teach each other, but I definitely say she's one of the mentors that I have right now. And then I had a great mentor when I was with the Mets. My boss, Luke Novosel, taught me a ton. So I've been trying to pay it forward. We have a round of interns right now. So I'm trying to teach them what we do and show them the way, so to speak. And it's been a great experience. I'm enjoying it. So I think being a teacher makes you better understand material. So I've had to check myself a few times where I thought that I might have known something, and then you say it out loud, you realize you don't know it as well as you thought. So it's been great.
That's great. All right. And, there's somebody else that we have mutual acquaintance. Actually, is going to be on probably next month onto this podcast. Is Eric Cressey. You worked with Cressey Performance for a little while, didn't you?
For sure. Yeah. So also in between going to PT school and undergrad, that summer I studied for the CSCS, and then I went over and interned with Eric Cressey in Hudson, Massachusetts, before the Florida complex was built. That was a great experience, and honestly, like, was my first real like exposure to like good sports training, and kind of blew my mind, and like it definitely had me gravitate more towards the baseball side of things. I think just getting real good hands-on coaching experience and working with baseball players just kind of solidified that that's what I wanted to do going forward. So
Yeah, I haven't been to Eric's place yet, but I have a good idea of how things flow there. But what was it for you when you got there? Give me a little bit of a rundown as those things that light bulb moments or your eyes
yeah,
became wider. What happened?
for sure. I think like during that time, like as an intern, you're trying to be a sponge and soak everything up. But I think hammering the basics, I know it's kind of a cliche, but getting really good at communicating was like one of the big things I took from that experience, and like working with a guy one-on-one. So um, coaching one-on-one, I think going into PT school, it allowed me like some exposure to like actually getting your hands on and coaching people, like whether that's cueing like a rib position or a pelvis position, or getting people to like feel things and go through those activities properly. Like that only prepared me going forward in my career as a physical therapist. But I didn't realize like how similar coaching in an S&C environment could be to like what I do in physical therapy. But that exposure really like opened that lane up for me.
Well, it's no surprise that most of the men and women that I have on the show that are have DPTs are also CSCS because it kind of just marries them together, I think. And the more it can flow seamlessly through the rehab to return to performance spectrum, the better it is for not only the professional, obviously, but for the athlete. And that it's just fewer batons get passed. It's almost like you're running side by side with each other. It's just that who's going to carry the load more compared to the other person, but you're on the same track, which is great. So along that line, I've been doing some BFR training, and I know you've been certified with blood flow restriction, and I can definitely see the benefits, especially when it comes to shoulder health and potentially elbow health. Um, so here's my question: It's like, where do you place the cuffs? Like for in the obvious places, like in the armpit or the upper arm and the groin, and do your legs. But have you ever placed it just below the elbow and performed wrist motions? Because I haven't heard anybody talking about that, but I wonder if you guys do.
So we don't actually. I've seen that like in private clinics. I know they have some
Yeah,
different like cheaper cuffs where you can connect Bluetooth through your phone, where they'll go like right underneath the wrist, or right underneath the elbow. But I've never done them myself. We have the typical like Owens recovery units. So we'll kind of go usually higher up on the arm or at the thigh for guys as like either a recovery piece, or if they're a post-op, we might use them as like a way to load guys when they're not really ready for any weight bearing type stuff.
gotcha. Okay, screening and assessments. What are your typical approaches and what methodologies or philosophies structures do you borrow from? SFMA, DNR, where
Sure.
DNS, where do you go?
Yeah. So a little bit of everything. I think I've been fortunate to be around really good clinicians, and like people have been exposed to a ton of different perspectives. I think, I've
Yeah,
taken SFMA, um, still kind of learning some different intricacies with that. I've taken a lot of PRI courses, so I have, just a way of viewing the body through that with the rib cage and pelvis. Bill Hartman's been pretty influential to me. Some of his information I think is pretty valuable, and some of David Gray's stuff. I've kind of taken a little bit of everything, but those are some more of my top influences right now. But I'm sure that will change
cool.
this conversation
Yeah,
in a year
no,
from
that's
now.
great. Actually, David and Eric both are going to be on next month. So, for
Oh,
listening
no.
audience, if you're not familiar with David Gray, yeah, we'll be having a conversation in the near future. Actually, yeah, yeah, they're about 10 days apart from each other, so they'll be appearing probably mid-August, end of August. But good guys, just fountains of knowledge and information.
For sure.
So, I don't really. I think a cheesy question or a cop out question would be to ask you your top five books, but at the same time, I'm kind of curious, like what are you reading? Are you reading anything, or are you of the generation where I just watch 2 minute videos because I don't know how to read anymore?
No, that's a great question. So I actually prefer Audible books because of that reason. I think
Oh, nice.
we sit at a desk and do a lot of work. So when I don't feel like sitting down, I'll throw an Audible in and go for a walk. So I'll do that a lot. One of the books that I hard copy I am reading currently is it's Principles by Dr. Chris Ahmad, the doctor for the Yankees. So he kind of just talks about different principles that successful people follow. So I think that's been a great influence for me currently. I'm trying to think of, I also read, this was an Audible, but The Energy Bus was a recommended book by my boss, and it's been a great perspective for, just being a good teammate and a player in the workplace.
What other things do you do for self-improvement? Curious.
Yeah, I mean, Con Ed, like I'm always taking different courses and I'll kind of dive into things. I struggle with kind of not going too far and learning too much. So what I try to do is relate it to a case that I'll have at hand. So if I have like a lower body injury right now, I have an ankle injury I'm dealing with. So that's kind of what led me to some of David Gray's stuff. And I'll kind of work through that. And then I might get another elbow or something and I'll go look up some research on that. So it kind of depends on where I'm at, but I will typically try to carve out some time, usually on the weekend, and I'll go through some different Con Ed stuff.
Oh, very cool. Okay. And is there something out there on the horizon that is kind of bubbling up to the surface that is piquing your interest? Some element, whether it's in your field or outside of it, you're like, I need to go check that out.
I would say definitely like from a biomechanical standpoint, those are the two, I guess those are the influences that I've had currently. So like I mentioned David Gray and some
Yeah.
of Bill Hartman's stuff is pretty fascinating to me. I know people have different opinions on it, but I think looking at the whole body and how the system might be at play, like there's just a lot of things that can go into it. And I think Bill does a really good job of relating different body parts and, keeping things simple from more of like a generalized approach.
Okay. Now we come to kind of a rapid fire. I'm gonna name off a team, and I'd like you to tell me uh, what you got out of the experience, the good and the bad. The bad's kind of testy, I don't want to step on toes, obviously, but if there's something that comes up, are you ready?
Sure.
Okay. Advantage physical therapy.
First clinic I ever worked at, I was an aide for my mother, so it was a great experience.
Nice. Performance physical therapy and wellness.
Performance physical therapy and wellness. I'm trying to remember. It's been a while.
It was 8 years ago in Darien or Westport, Connecticut. You
Oh
were
yes, yes, in Westport. That was a great experience. I was a student in undergrad, so I was able to ask very applicable questions as an aide as well. So it was
And
really
what
good.
was the downside of it?
Downside was I think I didn't have I didn't really understand like what I was asking at the time. I think,
Mm.
looking back, I was a little naive and you ask certain questions and now you can look back and be like, oh, like that was so obvious. But when you're still learning new things, it's kind of, it's a little bit different, if that makes sense.
Okay, so you were a strength and conditioning intern at UConn. What sports were you an intern for?
It was just football. So great experience. The bad part of that, I was driving close to an hour and a half the days that I would go over there. I just wanted to get some experience in a top D1 program, big school.
Okay, and you were at Exos.
Yes.
Give me
Uh,
a highs and lows.
Highs and lows. Exos highs, I got to learn from their model. The lows were that they were more of like corporate gyms, so it wasn't the population that I wanted to work with, but I definitely learned a lot more about dealing with people than I would have imagined in those experiences.
You were a student physical therapist at Spear Physical Therapy.
Spear
What about
Physical
there?
Therapy. Yeah, it was
Mhm.
also where I got my first job, so it was a great experience.
Nice.
Got to see a different population in New York City. Um, Downside was just a higher volume clinic, so had to deal with a little bit of that.
And then you were also a student physical therapist at in East Patchogue, New York, with Professional Care Physical Therapy.
Yes. Another great outpatient place. I got to work a lot more with athletes at that location. Again, I was driving about a little over an hour a day, so that was the tough part about it.
And then Resilient Performance Physical Therapy. You spent 4 months there.
Yeah, nothing but good things to say about Resilient. That's where I got really exposed to athletes, some different methodologies and exercises that I still use today. So nothing bad to say about those guys.
Damn. And then we've already talked about the Grays, the Mets, and now with the Twins and Spear Physical Therapy. Man, you just go from one place to the other. You fill up your knowledge base. And do the Twins know about this behavior of yours? I mean, do they know that you're, yeah, probably another month or so, you're going to be like,
No,
okay, guys, hey, I got news. I'm leaving. No. How long do
no,
you
this,
think you'll be with the Twins? How long do you want to be there, and what do you want to do?
I definitely want to be here for a bit. I mean, I interviewed for this job a few times. I think the people here are great. Like my coworkers are great. Like I mentioned, Danielle. I think I'm in a really good position to keep learning and growing with this organization. So I don't really see myself going anywhere anytime soon.
And they've got an awesome complex down there, an awesome facility. It's like
Absolutely.
almost bar none. There's very few that have what you guys have there. And and when it comes to professionals to athletes, it's pretty low ratio, isn't it? It's not like, yeah, like you said yourself, 6 or 7 in a week. That's a low level. I mean, if you were in a physical therapy clinic or something, you'd be seeing that many people before you took your lunch break, most likely. So
Yeah.
you spend what, like an hour to 2 hours with an athlete? How long do you average your time with them?
So 6 or 7 is like a good week, I would say. Like where that's not always the case. But it depends on the day. So guys will go through their whole routine. They'll come in, do some training room stuff, and we'll get some hands-on, kind of prep them for the day, and then they'll go do their baseball activity and then come back and either do some Therex or some recovery modalities. So we're getting a good chunk of time with them. It's usually, from the early morning to early afternoon, and then the rest of the day we're spending like, doing more of the behind the scene things and you know paperwork, that type of stuff. So it does vary. I would say it's a good week if I'm seeing 6 or 7 people, but there's definitely more often than not we're seeing a lot more than that.
So it's been about a decade now. You've been working in a physical therapy world. How has the advances in the last 10 years affected your level of care? Where you were when you were beginning to where you are now, are there certain elements that are are really critical, or science that is emerging that is making you more effective? How has the evolution in the last 10 years affected you?
For sure. I think some of that's a little tough to answer because I'm still pretty young in this profession. But if I think back to like early on in like working in outpatient clinics to now, I think the technology has advanced tremendously. And I think, some of the technology that we have in pro sports, I'm sure you'll see it trickle down into more like outpatient facilities. Just an objective measure. Like we've always had goniometers and we've always had our hands, but like to be able to have like, units that can measure force output or, a dynamometer that can measure strength, like those are tools that are becoming a little bit more accessible to the public. And I think, going forward over the next 10 years or so, like that's only going to become like more feasible. And I hope that'll help, clinicians everywhere treat people, get a little bit better, a little bit quicker. But I'd say that's probably the technology has been the biggest aspect that I've noticed a difference.
Damn, you're way too modest. Okay. I wish you brought more ego because I really want to get to the nitty gritty. No, I'm just kidding. That's all right. So let's talk about you specifically with your hips, kind of going back to those labral tears. Have you noticed some type of movement patterns that have kind of emerged and established and normalized because of those experiences? And how do you take that personal experience and knowledge, and does it carry over into working with your athletes?
For sure. I think, I've learned different compensation patterns from dealing with it myself. And it's been an easy, hey, like I know what worked for me or what doesn't work for me. And there are things that I'll still stay on top of to make sure that I'm in a good spot. And I might have to modify training here or there, but I think it only gives me like a better lens, both from like a understanding where an athlete's been, but also like, hey, like this might be something they might not be able to do ever, but if they can get to a good spot and like play their sport and excel at the end of the day, that's kind of the goal. So
All right, give me a specific example of getting to do some movements or approaches that you're still doing?
Sure. So I would say, like, if you look at my current block of training, like, I don't really deep squat ever. It doesn't feel great, but I will do more like velocity based stuff in shorter ranges, and that stuff works wonders for me. So I think there's been some opportunities for us to implement some higher velocity type training with different guys, or different, whether it's a positional or drill work type thing that might work wonders for different people. I think some of the pelvic stuff specifically, like, I've been able to recognize a lot quicker, just having that experience myself.
And what about a unilateral approach to getting into a deeper hip
100%.
flexion or a loaded position? So much better.
I think especially for these athletes, like, unilateral lifts are huge, and I probably prefer it for most guys, unless it's like you're very new to lifting athlete where he just needs some foundational strength. But these guys are so asymmetrical in what they're doing, and unilateral lifts will help address some of these different deficiencies that they'll have from side to side.
From a positional standpoint with your athletes, I'm going to say that there's usually a higher incident rate of elbow shoulder with pitchers just because of the force, the power they produce and have to decelerate, and the number of repetitions and so on, compared to, say, infielders, outfielders, or the catcher. So are there issues in the tissues, shall we say, based on positions that you start to see? For instance, the catchers are always loaded into that deep squat position for several hours at a time, albeit with breaks in the innings, obviously. And then you've got a lot of really hard, moderate distance sprinting for the outfield. You've got just short step power for the infield. I can see there being kind of issues arising based on their physical demand of their position. Do you see that, or am I just blowing smoke?
No, I think that's actually pretty spot on. And you can break it down a little bit further, like what you're talking about. I think in catchers, you're going to see, a lack of internal rotation. Like, these guys, you'll get them on the table and their hip ER, like, you can crank them all the way out, but they might have like either a structural adaptation or like a bony block, and they might have like 5 to 10 degrees of internal rotation. So from that perspective, they're more likely to have issues trying to get into internal rotation, which could lead to like a low back issue in the weight room, which can trickle down into these different things, versus like your first baseman might be a little bit along the same route of, like, he's a little bit more limited in motion. He doesn't move as well, so he might have other compensations. Your infielders, your outfielders, like those speed guys, you're going to see like baseball injuries. One of the most common injuries is a hamstring strain. So your high velocity guys, they're just as likely as the slower guys, if not more likely, because they're running a lot more. So you'll see a lot more of those soft tissue injuries in some of those speed guys or more positional guys.
So
I'm sure sorry,
your
you
industry,
can
no,
break
no,
it
my
down a
my
bit
fault.
more.
I completely went into and interrupted you, but I was thinking about the hamstring strains. And your industry historically has been one to make up protocols for the symptom as it arises. And
Sure.
yet there's been a transformation in certain circles of physical therapy where they're putting the protocols aside and dealing more with the individual and how they're producing or not producing force. So it's a more individual approach rather than a symptom-based protocol. And so with hamstring strains, how do you approach it? And so now that I just slammed protocols, if you have a protocol, I apologize. But how do you approach hamstring strains?
No, I think it's great. I think, it's good to have a little bit of a protocol or like a general guideline, but I
Yeah.
think for the most part, I would completely agree. I think every case is going to be different. And I think running is the best recipe to help with hamstring strains. So Derek Hansen's put out some really good content where he gets guys moving really quickly, kind of like a short to long approach. I would kind of side with some of that. So getting, early on, I'm going to get a guy and look at, we'll do some soft tissue work. I do tenderness mapping, which has been supported in research, where you're going to track the area that's sensitive over time and hope that that's shrinking. And then, we'll do some soft tissue, some activation early on. And then it's like, how quickly can we get this guy back to running, whether that's, short bursts of accelerations to then progressing over time. We'll use, our vol data, some of the resisted testing to determine if a hamstring is, equal to the other side, or if that strength output is what we'd like. But I'd like to move pretty quickly with, depending on the issue. I think, if you can get grading on the hamstring strain, whether if it's imaging, that'll tell you whether it's, a myofascial injury, or it might be more tendon-like, and that might dictate a little bit longer of a rehab. But if it's a shorter, more myofascial, I might go a little bit quicker, do a ton of, low load, long duration isos. If they're feeling good, we're going to keep kind of pushing through different strength cycles. So you can go through your concentrics, your eccentric work, into your tempo work, and then progressing like seamlessly into the gym. So a little bit of a rant there, but you kind of ebb and flow depending on the injury, depending on the guy. But I think, if we can move quickly with these things and get guys back to doing what got them injured, maybe some coaching along the way there, like that will tend to show some really good results.
Do you have a way of determining whether the athlete needs more concentric work, more eccentric, or perhaps even more isometric? Is there some kind of way of determining that for you?
For me, no. I know there are definitely ways. Like, there's different tests that I've been exposed to that you can do, whether that's like a hamstring ISO test on force plates. You can look at squatting or different things. For the most part, like, I'll kind of go off symptomology, and it, like a 2 or a 3 discomfort is what I'm okay with these different, exposures. So if a guy's asymptomatic with isometric stuff, I'm going to, quickly go into concentric. And then, hey, if that's a 2 or a 3, I might stop there and wait for that to go down a little bit, and then get into eccentrics. And so I'm kind of using more of like a pain threshold approach. But I know there are definitely some different ways that you can explore some of the specific phases of strength work.
And do you follow it up or down the chain? Like, if we're talking the hamstring strain, maybe it's because that hamstring was asked to decelerate a greater degree because the spine wasn't properly flexing and decelerating, or we didn't have proper ankle dorsiflexion or whatever. So do you start to hunt above and below to see, hey, maybe if we got a little bit more range of motion here, or slowed down this process here, we're going to have a better kind of kinematic sequence to their running or sprinting?
100%. I think you gotta have to take like a zoom in, zoom out approach. So like, you zoom into the hamstring, first day or two, you try to calm that down, you zoom out, see, okay, what led to this? Because it's not just the tissue that's injured that's leading to that. And then you'll kind of go back to hamstring strengthening. You might go back and look at the hip. You might go back to that. You look at the foot. So it's kind of a zoom in, zoom out approach is how I kind of look at any injury. And it's definitely with the hamstrings is, there's a lot of factors at play here. So identifying what you can, to give that more of a global improvement would be beneficial.
Have you ever had a case, ever discover it where X did not mark the spot, but it was in some kind of obscure place, like they had sprained their throwing, the thumb on their throwing hands, and that led to a whole cascading down into that hamstring? Have you ever kind of like had your mind blown away that the concussion they suffered from 5 years ago rearranged their posture and alignment, that it put more strain in area? Anything like that? Did you ever have one of those?
Yeah, I think you bring up concussion. I think that's actually like one of the number one pieces where, like, you'll work with the guy for a little bit, they won't have the improvements that you'd expect, and then you start to dig a little deeper and you find like, yeah, like, this guy's had 5 concussions in his life. It's like, oh, like we knew there was a cervical component, but maybe there's a little bit more to that. And then you've got to dive a little bit deeper into whether it's a vestibular check or, upper quarter screen. Like, I've had tons of cases. I think being in long-term rehab, you get the opportunity, if a guy's a post-op, to spend the time to really, dig deep at guys. So yes, I've absolutely noticed that. I think
Great.
also, like, I think the tough part is getting, whether it's your average person in an outpatient facility or the athlete that you're working with, to understand that every injury definitely matters, and, they're all related somehow. So the more information that you can provide, the better that we can treat what's really going on.
And okay, highlight of your daily operations. What do you wake up in the morning going, heck yeah, I'm going to get to do this again? What is the thing that really jazzes you?
I think, the guys that have I would say the things that excite me are the guys that are really struggling or have had a tougher injury and they can't get out of it, or they've had something that might bother them for a while, not related to the injury, and I can help them with that and improve their life. To me, I love doing that. I think I also love, the guy that comes in that's injured and we get him out of rehab and he's throwing harder. Like those cases to me is like, how can we improve a guy, not just from a health perspective, but get him out of here from a performance perspective? Those are the things that I'll wake up to and love. And then just getting to be on a baseball field every day, like, is another thing that I love waking up to. There are days where I'll get to play catch with guys and help a guy through a throwing progression. Like, I mean, it beats sitting at a desk all day. So I'll say that it's definitely a fun job, and I'm blessed to be where I'm at.
And I imagine that the thing that drives you nuts is not getting to the root cause or source of what's going on. If you've got somebody with a lingering issue and you just feel like, damn it, that didn't work. I tried this didn't work. What am I missing? Do you have those days?
Every day.
Every day.
Every day.
All right.
Yeah. I would
So how do you
say
get around that?
it's conversations. I'll talk to Danielle, I'll talk to our other PT Nick, I'll talk to friends in the industry. Like I think the human body is so complex, and sometimes things work and we don't even know why. And you think you do, and then you get humbled in a different case. So I love this profession, but it's very frustrating because there is no textbook answer for anything.
I love it. I know. I kind of just think that we're still, as much as we're learning, we're still in a medieval phase of this. It's so young. I mean, to physical therapy stemmed from basically World War II with wounded war veterans and emerged into what we have today. And it's still holding on to old concepts and struggling to let those go for newer ones. And yet at the same time, there are some basic tenets, some fundamental foundations that we always have to kind of go back to. And it's wonderful because that means that there's so much room for improvement and options or opportunities to learn. So really quite cool. Okay, so further down the pipe here, Danny, do you want to take over as the director of performance for the Minnesota Twins? Like, what do you aspire toward? I know, we'll
Sure.
we'll cut this out maybe so your bosses don't hear anything, but it's good to have goals, right? And if you tell me I'm exactly where I want to be and I could be here for 20 years loving life, I don't want to go up the ladder any further. But honestly, between you and me, pal, I looked at your resume and it doesn't seem to be, that doesn't hold water. So what's the high point? Where do you want to be?
Yeah, I mean, to be honest, yes, I'd love that type of position. I'm at the point where I'm just trying to learn everything I can. You kind of brought up some like topics that I definitely am dealing with on a daily basis of like, I want to be like a phenomenal clinician and be able to identify those things that other people miss. So once I feel confident and I can get to that point, like I would love to like take what I know and apply it a little bit more, whether that's a director position or a major league position. Like 100%. I think that's, at the end of the day, you want to always climb the ladder. But I will say, like, I am humbled daily, and I definitely would like to have a little bit more answers than I do currently. So I like being in an area where I can learn and tinker and try to get better and obviously do right by the patient, if that answers your question.
It does. It does. It doesn't say that you're looking to be complacent. It doesn't, and or nor comfortable. I mean, we always have to have certain level of being uncomfortable because if we stay in our comfort zone, we're never going to learn and grow. So to aspire to learn more is great, but to know that we're never going to learn everything, but to at least go in that direction is something else. If people want to follow you, are you on social media, LinkedIn, Instagram, and so on?
Yeah, if you look up my name on LinkedIn, Danny DiGregorio, and then on Instagram, I'm not too active, but I do have a personal account, DanDig3. You can ask me questions on that. Feel free to reach out. I know what it was like trying to get into my position, so I'm very sympathetic towards students or other professionals that are looking to get into pro sports or residencies or anything like that. Like, I'm very happy to have conversations with anyone because I was hitting up everybody trying to get to where I am right now. So
Well, congratulations for being where you are. And obviously, every door that opens, you at least poke your head through there and see if it's something you want to do. And I think that's a good habit and a good lesson for everybody to take home today. But I can't thank you enough. This has been really super. And I look forward to the time where we actually meet face to face.
Absolutely. Thanks so much for having me, Rocky.
And that's one more episode in the books. I want to thank Danny for coming on, and thank you to the Twins organization for allowing it to happen. Remember, if you're coming up on needing CEUs pretty soon, just go to my website, rockysnyder.com. We've got online courses as well as in-person workshops that are happening across the country. You can find out more there. Remember, setantacollege.com. Also, if you put in the code RS10, you can get 10% off your entire graduate degree tuition, whether it's in applied sport, exercise psychology, sports injuries and return to performance coaching. They've got a whole bunch. Just check them out. We'll see you next week.